Senator Murkowski.
Mr. Chairman, just quickly, I want to submit for the record unanimous consent to enter a record into the statement from the American Cancer Society Cancer Action Network.
Without objection. Senator Murkowski.
Mr. Chairman, thank you for this hearing, and I want to accept the chairman's challenge this morning. You've kind of challenged us here. We've got a couple of things that we need to be thinking about. We've got the short term, and it is really short. It is really short. It didn't have to be this short. I believe it was December 12th of last year that I raised a flag about this, that we were going to see this, we were going to be dealing with this cliff, and it wasn't going to be comfortable, and for a host of different reasons. That conversation was deferred early in this year, and things started to heat up this summer. And we are where we are. But I am in the same camp as Senator Collins has outlined as a Republican who cares deeply about this issue, because my home state of Alaska appears to suffer some of the most extremes of the extremes when we're talking about these high costs. And people are expecting us to come up with a solution. They're looking at this cliff and saying, what we are paying already, to your point, sir, the status quo is not sustainable, but if we fail to act, if we fail to do something relatively soon here, the consequences are severe to people. When you're talking about close to 1/3 of your family's income going towards your health care coverage, I got a text from a friend over the Thanksgiving break here, and she was telling me about the insurance that she and her husband currently have. They are in their late 50s. She says this was before the ACA. For 2 years, they paid $2,600 a month, $30,000 a year for a terrible plan, high deductibles, no dental, no vision, terrible plan. We just watched our dollars go out the door. Every one of us gets messages like this from friends and colleagues. They were able to receive support through the subsidies. Their premiums went down to $500 a month, and then even lower than that. And then just recently, they got their notice saying that for the exact same terrible plan, they're going to be paying $3,000 a month, $36,000 per year. And she asked me the question. She says, I asked you why you voted against the repeal of the ACA back then, and you said it was because there wasn't a replacement. Have you or others been able to come up with a replacement? So we got two issues here. We've got a situation where she's now going to be looking at $36,000 a year that she and her husband are going to be paying, but she also fairly wants to know, what's the plan here for reducing overall cost of care? And Mr. Chairman, I think you've pegged it here. We need to address the short-term reality that we are facing, and we need to be looking long-term. And again, this is the role of this committee, to be doing exactly that. And so I want to focus on not the message, not to be able to say, I told you so, it was coming, but I want to be able to say, we have helped address this. I think we're going to need to have a short-term extension, but I think we can put reasonable caps on. I think that we can put some of the parameters that we have been talking about. There's no great secret sauce here to how we're going to deal with this particular dilemma that we're in, but we've got to be looking longer term to how do we ultimately reduce these costs of care. I have 1 minute left in my comments, and I want to ask a question about kind of the longer term, because we're going to work out or not work out whether people like my friend are going to be going off of this cliff and making a decision that they're not going to be covering themselves potentially. But we focus a lot, or we talk a lot about the prevention side, and we know that if we can keep you from getting sick in the first place, we save some money. I've been watching what we've been doing recently, and I'm concerned that we're seeing some major cuts to public health and prevention funding. I worry about that because I think that actually helps us in the long run. If you had to pick one or two prevention type programs that have the strongest evidence for reducing long-term costs, what would you tell us to prioritize? And you got 2 seconds. Mr. White, quickly, what would it be?
I would allow premium discounts in the individual market for wellness programs. Those are currently illegal. We can incentivize people to take better care of themselves through financial incentives.
Yeah. Ms. Strauss?
I would open up HSA accounts to allow for more holistic and preventive services to flow through those accounts. And then also really highlighting direct primary care and the ability that we have to go lower prices through direct primary care and making sure people are actually getting the care that they need.
I think primary care as well as screening. We chart, pap smears, colonoscopies, the things that we know save lives.
Thank you, Mr. Chairman.